Natalie.
Hey, Sarah.
How are you?
I'm pretty good. Yeah, I'm okay. But
Okay.
I have maybe some questions to run by you.
Sure. So definitely supervision time is perfect for that. So what's going on?
Okay, so I have a client
Okay.
who is a young female, and I've been seeing her for a little while, like a month or so, for anxiety.
Okay.
And now it seems that some symptoms of an eating disorder might be cropping up, and I don't know enough about eating disorders. It's not really in my area that I've worked in before. But we work well together,
Okay.
and I am questioning if the client is still within my scope of work.
Okay. So a young adult female client, you work well together, they came in to work on anxiety, and now you feel like maybe some eating disorder symptoms are coming up
Correct.
and you're not sure like where to go with this and if you can do that work.
Correct.
Okay. Well, so that's a perfect question for supervision. I'm super glad you brought it up. And as you know, I think from working here for a little while, eating disorders is one of my specialties. So I'm super glad you brought this to me. I'm actually also just want to say that I'm really impressed that you identified these symptoms that seem outside of what you were scheduled to work with them on, right? And had the forethought to bring it to someone else to discuss if you're still the right fit, even though it sounds like you really like this client.
Yes.
Yeah.
We do work well together.
Yeah. So, and I know that you also have been recently developing a lot of skills, and we want to like use those skills. And so I'm so like glad that you aren't just feeling like blinded by like I can do this with them and it's fine and just tunnel vision.
Right. I want to make sure that they get the best help. So
Yeah,
I want to make sure that they are getting everything that they need.
that's so great. So, again, just want to like jump, right? So let me ask, you mentioned that you believe they have some eating disorder symptoms. Can you tell me what it was that they brought up?
She was talking about vomiting, like after eating in different times, and talking about her body image, and then mentioning talking about other females, comparing herself to other females.
Okay. And did it seem like the vomiting, like I mean, and this may seem like a silly question, so forgive me, but did it seem like she said, "Oh, I had the stomach flu when I was vomiting," and snuck it in there, or is this like you got the impression that she was like making herself vomit, or she felt bad about what she was eating, and
It didn't sound like it was a cold related
okay,
issue.
so like a voluntary,
It
like
sounded
making
more
herself do it.
right.
Okay.
And she was talking about what she ate, and then after she got sick, but she didn't say that she.
Okay.
Yeah.
Okay. Did you ask her if she has an eating disorder? Or ask her anything like that? Or were you maybe not sure how to approach it? Like what?
Yeah, I wasn't really sure how to approach that.
Okay. And that's totally fine, right? Because you don't want to just throw something out there that could be like a therapeutic bomb, right? If you're not really sure and it's that you have a good positive relationship and she's coming back regularly, I think it's okay that you bring it to somebody and consult about like what's a good next step. And you have plans to see her again soon?
Yeah, she's been coming in every other week.
Okay.
Every week.
And what? Oh, every week? Okay, that's good. That's better. And does she, can I just ask, I know you haven't done like a physical assessment on her, but does she look like she's seriously underweight or does she look like just like normal weight, like you wouldn't have thought of this if she hadn't said it or?
I guess I wouldn't have thought
Okay.
this
Okay.
about her.
And that doesn't mean that she's not in any physical health danger, but it can be a good basic sign that that she's probably not like plummeting to such a low BMI that she needs to be hospitalized tomorrow. Because one thing when we think about the eating disorders is just making sure that they're physically safe, like safe enough to make it day to day. And it doesn't sound like she's like an extreme low weight client. So okay. Well, thank you for answering those. It's helpful just to making sure like where to guide you. And so what I would say is we definitely want to, if she is potentially forcing herself to vomit and she's doing, comparing herself to other people, those are some key indicators behaviorally and of the core psychopathology of eating disorders. And they're strong indicators that she may have an eating disorder. So, what I think would be really helpful is if we could have her meet with one of our eating disorder team people for an evaluation to see if she does have an eating disorder. Because when we think about the, I guess we could call it the order of priority of what we want to treat. If someone has an active eating disorder, most of the time that would be the primary thing we would want to work on. And so, and I think we may have talked about this case before when they first started with you, and I may have even watched your video. I think I know who you're talking about. And if I'm understanding it correctly, the anxiety is impactful to her, but isn't like stopping her from living her life. Okay. So since the anxiety is not like at a severe or crippling level, it's likely also that the eating disorder is seriously contributing to the anxiety. Anxiety, especially social anxiety, is really high in eating disorders. Yeah, I see you nodding and smiling, right? Okay, good. So I'm connecting with it.
Yeah.
So I think that through doing eating disorder work, she can probably get a lot of help with some of the things you've been trying to help her with. And that if she doesn't get work on the eating disorder, you may find that the work you do with her seems helpful but doesn't stick in the long run. So, but we also want to be respectful of the fact that you work well together. So here's what I'm thinking is that she already knows that I review all your sessions in video, and she already knows that you consult with your supervisors about your cases. So she's aware that we would be talking about the case. So you can use that you've already established at your intake to bring it up and say that through supervision, we noticed some symptoms that we're so glad that she shared, and we want to give like proper attention and care to. And you can mention those couple things that she already voluntarily brought up, and maybe ask her if those things are concerning to her. Because oftentimes when they bring something up, even if they kind of sneak it in, you can kind of take the hint that they're wondering if you'll catch it. Yeah, right? So maybe take that as a sign that she was comfortable enough with you. You did a great job as an intern doing something that actually interns are better at than a lot of clinicians when we score it, which is building therapeutic alliance and increasing client satisfaction. Did you know that? Interns who walk around feeling like they know nothing, right? Clients love you because you're just like, I'm here for you. So you did a great job making her feel comfortable enough to share this with you. And I think you have just opened a gateway to some real more in-depth treatment that she may need to do with someone who has the training in the eating disorder group. So you bring that up, let her know that you heard it, you paid attention to it, and you want to validate that that sounded important, and you would say to her that that you do really enjoy working with her, and you're still here, but that would she be open to meeting with someone on our eating disorder team to talk more about those things and to just explore them and see if there's anything there that she would like help with. And you can also feel free to let her know, because this is true to our policy, that if she does go there and for some reason decides that she wants help from the team and goes through that treatment, that after that's said and done, if she would like to resume services with you, and work on some lingering anxieties or something like that, that if you both still feel it's a good match, that she would be welcome to do that.
Sounds appropriate.
Because then it helps also her not feel abandoned.
Right.
Because it sounds like she's like.
I'm not just going to pass her off and never see her, talk to her again.
Right.
If she wished. Yeah.
Right. So, so what do you think about this? How does this feel as a plan?
I think that makes sense. Yeah. a
And we'll
good way
make,
to approach it with her.
okay. And if she agrees to that, we'll make sure that, we ask her to sign a release between you and that clinician, and see if she's comfortable with that. So that you and that clinician can be in touch about the interventions and care she's getting there with them in the team, and just, so then she may also be just happy knowing that you're still part of her team. And if she decides she doesn't want the evaluation,
Okay,
then it's okay to say, to ask if she has any special concerns about it or anything you can help her feel at ease about. But then let her know that you'll seek supervision again about how to best help her,
right,
because we want to be, as we said before, very helpful to her. And so then you and I, if that becomes the next step, you and I will talk about it again.
okay.
Okay. Any other questions about that client, or is that really give you what you needed?
It feels like that gave me what I needed for at least right now.
Okay,
Yeah.
great.
Thank you.